So the president's diagnosis has lots of people talking and asking questions, especially since he is 74 years old.
Our 9 Health expert, Dr. Payal Kohli, is here this morning with us. Dr. Kohli, thanks so much for being with us. And we want to start with the president's age, like Gary just mentioned. What can you tell us about the risk of hospitalizations, ICU admissions, and deaths in patients in his age group?
Good morning, Gary and Natasha. So as you all know, and we've been talking about for many, many months now, being older puts you in a higher risk category of being hospitalized, of getting into the intensive care unit, and also of dying. In fact, the CDC estimates that your risk of hospitalization is about 5 times as high as compared to young people for those in their 70s. And your risk of dying is 90 times as high for young people, for those in their 70s as compared to young people. Now, if you look at the numbers here in Colorado, about a quarter of all the deaths that we've had so far are in people in the age group of 70 to 79. And more on a global spectrum, the CDC is estimating that in that age group, the mortality rate from this infection is about 5.4%. So relatively high, again, significantly higher than the flu. And then finally, we also know that males tend to have a higher mortality rate than females. So those are sort of what the numbers that are going through my head. But overall, I do want to say that even though this news is very unsettling, the likelihood that the president will recover from this infection is very, very high.
Yeah, I was going to ask you about that. I mean, even in his age group, some people do very well with it, others end up on a vent. So is there a way to tell how the president may do with this?
That's a great question. I mean, there's so many factors to this that determine that, Gary, that it's really hard to speculate how he may do. Currently, we do know, based on his physician from the White House, that he doesn't have any symptoms. So really, the next 7 to 10 days are going to be the most telling in terms of what his clinical course ends up being, because that's usually the period when people start to decompensate and end up in the hospital if they are going to get sick. Now, the president does have some high-risk features in addition to age. We also know that he qualifies as obese based on his body mass index, which is also another high-risk feature. We know that he has high blood pressure on some of his physicals, again, another high-risk feature. And then finally, we also know that he has something called coronary calcium, which is a marker of plaque or blockages in the blood vessels around his heart, which is a sign of heart disease. Now, we know the president went to Walter Reed last year. We don't know exactly what happened and why that is, so there's still some details about the president's medical history that are unknown.
A lot we still need to learn. Dr. Kohli, thank you so much.